Did you know that every medication and supplement you take passes through your liver, putting it at risk for damage? This damage, called drug-induced hepatitis, can happen suddenly or take up to 90 days to manifest. Why? Because your liver acts like a filter, eliminating toxins. But unlike your kidneys, which can be supported with dialysis if they fail, there's no machine that can replace your liver. In the US alone, over 2,000 cases of acute liver failure occur each year, and half are caused by medications or supplements. While many drugs can affect your liver, there are 10 that are particularly harmful. Let's find them out. Number 10. Diclofenac. Let's kick off our list with a common culprit lurking in your medicine cabinet: diclofenac. You might know it as Voltaren or by other brand names, but this anti-inflammatory packs a punch when it comes to potential liver damage. While all NSAIDs, non-steroidal anti-inflammatory drugs, like ibuprofen or naproxen, carry some risk, diclofenac stands out as the heavyweight champ of liver injury. This doesn't mean every pill will wreck your liver, but it does mean caution is key. Unlike the immediate pain relief diclofenac offers, the damage it inflicts on your liver can take weeks or even months to show up. It's a slow burn, making it even more important to be vigilant. And it's not just your kidneys that diclofenac targets. Your liver is in the crosshairs too. So, if you're reaching for diclofenac to tame that inflammation, remember, moderation is key. And if you notice any unusual symptoms like fatigue, jaundice, yellowing of the skin or eyes, or abdominal pain, don't hesitate to talk to your doctor. Your liver will thank you for it. Number 9. Augmentin. This commonly prescribed medicine is used for various issues like respiratory infections and skin problems. However, despite its ability to fight germs, it poses a risk to your liver. While liver injury from augmentin is relatively rare, it's still the antibiotic most likely to cause it. The damage usually occurs within days to weeks after starting treatment, and it seems to be more common in men, older adults, and those who've taken the drug multiple times. The good news is that in most cases, the liver damage caused by augmentin is reversible, and your liver can bounce back. But it's still a reminder that even common medications can have unexpected consequences. So, if your doctor prescribes augmentin, don't panic. Just be sure to keep them informed of any unusual symptoms you experience, and they can monitor your liver health to ensure a safe and effective treatment. Now, number 8 on our list is a heart medication with a bit of a dark side. Number 8. Amiodarone. It's a powerful weapon against irregular heartbeats, but it can also wage war on your liver. Cardiologists often turn to amiodarone when other treatments fall short. It can work wonders for arrhythmias, sometimes even clearing up issues completely. However, this medication isn't without its baggage. Amiodarone is notorious for having a wide range of side effects. It can mess with your thyroid, lungs, skin, and yep, your liver too. That's why it's not as freely prescribed as it used to be. These days, it's reserved for situations where the benefits clearly outweigh the risks. The good news is that amiodarone-related liver damage usually isn't a sudden attack. It often takes weeks or even months to manifest, giving doctors time to monitor your liver enzymes and adjust treatment if needed. But it's still a risk you need to be aware of. So, if you're taking amiodarone, stay in close contact with your doctor. They can help you weigh the benefits and risks, and keep a watchful eye on your liver health throughout your treatment. Number 7. Allopurinol. This medication is a lifesaver for those grappling with gout or elevated uric acid levels, but it comes with a catch. While it effectively reduces uric acid and prevents those painful gout attacks, it can also throw a wrench in your liver's works. Now, before you panic, the liver injuries linked to allopurinol aren't always severe. Some people experience mild, reversible changes in liver function, but what's alarming is how quickly these changes can occur, sometimes within days or weeks of starting the medication. That's why it's crucial for anyone taking allopurinol to get regular checkups and blood tests to monitor their liver enzymes. It's like having a security system for your liver, alerting you to any potential problems before they get out of hand. But that's not all. Allopurinol has also been linked to a rare but serious condition called DRESS syndrome. This involves not only liver problems but also fever, rash, and other systemic symptoms. And in even rarer cases, it can trigger severe skin reactions like Stevens-Johnson syndrome and toxic epidermal necrolysis, which can further damage the liver. This is why it's important to immediately stop taking allopurinol and seek medical attention if you experience any of these symptoms. Number 6. Anti-seizure medications. Phenytoin. While they're essential for managing epilepsy and seizures, anti-seizure medications like phenytoin, dilantin are among the top contenders for causing drug-induced liver injury and even liver failure. Now, before you start panicking, let's clarify. This is a rare occurrence, affecting less than 1 in 1,000 people. But it's still a sobering reminder that even life-saving drugs can have serious consequences. What makes phenytoin particularly worrisome is its ability to trigger a whole cascade of reactions in your body. It can lead to anticonvulsant hypersensitivity syndrome, DRESS syndrome, and severe skin conditions like Stevens-Johnson syndrome and toxic epidermal necrolysis, all of which can wreak havoc on your liver. The liver damage usually starts within a few weeks of starting phenytoin, so it's crucial to be on high alert for any unusual symptoms. If you notice anything amiss, talk to your doctor immediately. The good news is that in most cases, stopping phenytoin allows the liver to recover, but early detection is key. And phenytoin isn't the only anti-seizure medication with this potential. Others like valproic acid, carbamazepine, and lamotrigine have also been linked to liver problems. So, if you're managing seizures with medication, be sure to have open conversations with your doctor about the risks and benefits, and don't hesitate to ask any questions you have. Number 5. Methotrexate. This is a double-edged sword for you. It's a powerful weapon against conditions like rheumatoid arthritis, psoriatic arthritis, and certain cancers, but it can also be a storm on your liver. What makes methotrexate so tricky is its dose-dependent nature. High doses, typically administered through an IV, can cause a dramatic spike in your liver enzymes. But thankfully, this is usually temporary and often doesn't lead to lasting damage. However, the lower doses you might take daily as a pill aren't off the hook either. They can increase your risk of developing fatty liver disease or scarring, especially if you already have other risk factors like obesity or excessive alcohol use. Because of this delicate balance, anyone taking methotrexate needs to be closely monitored with regular liver enzyme tests. It's like keeping a close eye on a ticking time bomb. You want to catch any problems early on so you can defuse the situation before it explodes. Number 4. Azathioprine, Imuran. It walks a tightrope between healing and harming. This drug is a key player in the world of organ transplants and autoimmune diseases, taming an overactive immune system so your body doesn't attack itself or a transplanted organ. But it can sometimes overstep its bounds and launch an attack on your liver. The type of liver injury azathioprine can cause is a bit of a mixed bag. For some, it's a mild, temporary bump in liver enzymes. But for others, it can develop into a more serious, long-term issue, sometimes taking years to manifest. And it seems transplant recipients are at a higher risk for this unwelcome side effect. Now, this doesn't mean azathioprine is a ticking time bomb for your liver. In many cases, the damage is reversible if the medication is stopped, but a reminder that even medications we rely on for survival can have unintended consequences. So, if you're taking azathioprine, don't let your guard down. Keep an eye on your liver function and report any unusual symptoms to your doctor. Number 3. Isoniazid, INH. Isoniazid, or INH for short, has been a lifesaver for countless individuals. This antibiotic is also one of the top 10 most common causes of drug-induced liver injury worldwide. It's a bit of a paradox, right? A medication that heals can also harm. Isoniazid can cause mild, temporary elevations in liver enzymes in up to 20% of people taking it. But the real concern is the 1% who experience more severe liver injury. In fact, it carries a boxed warning, the FDA's most serious type of warning, about the risk of severe liver inflammation. However, certain factors can amplify the risk of liver damage from isoniazid. Women, Black individuals, people with existing liver problems, older adults, and those who enjoy a daily drink are all more susceptible. It's like adding fuel to a fire that's already smoldering. So, it's important to be aware of these risk factors and take necessary precautions. Number 2. NSAIDs, non-steroidal anti-inflammatory drugs. These pain relievers, like ibuprofen, Advil, and naproxen, Aleve, are staples in our medicine cabinets. But did you know they can silently wreak havoc on your liver? While most people tolerate NSAIDs just fine, these drugs are not without their risks. One NSAID in particular stands out as a major offender: diclofenac. It's a heavy hitter when it comes to potential liver damage, and it's not just a rare occurrence. Elevated liver enzymes, a key indicator of liver injury, are seen in many people taking diclofenac, often without any noticeable symptoms. But it's not just diclofenac that poses a risk. Other NSAIDs, even over-the-counter ones, can also cause liver problems, especially when taken in high doses or for extended periods. And the risk increases if you're mixing them with other medications or have pre-existing liver issues. It means that if you're taking NSAIDs regularly, it's important to monitor your liver health and discuss any concerns with your doctor. They may recommend more frequent blood tests or suggest alternatives to NSAIDs. Number 1. Statins. Sometimes the very medications designed to protect your heart can inadvertently harm your liver. Statins, those cholesterol-lowering powerhouses, are a prime example. They're prescribed to millions worldwide to lower bad cholesterol and reduce the risk of heart attacks and strokes. They can also put a strain on your liver. While most people tolerate statins well, they can cause an increase in liver enzymes in some individuals. This usually doesn't cause any symptoms and often resolves on its own. But in rare cases, it can escalate to more serious liver problems like hepatitis or even liver failure. So, why does this happen? Well, your liver plays a crucial role in metabolizing statins. If it's already struggling due to other factors like obesity, alcohol use, or underlying liver disease, adding statins to the mix can be like throwing another log on a fire. But don't panic if you're taking statins. It's important to remember that serious liver problems are uncommon. Your doctor can monitor your liver function with blood tests and adjust your medication if needed. And if you experience any unusual symptoms like fatigue, jaundice, or abdominal pain, be sure to let your doctor know right away. You've now known about 10 common medications that can potentially harm your liver. Remember, this doesn't mean you should stop taking any prescribed medications. Always consult your doctor first. But by staying informed and vigilant, you can take proactive steps to protect your liver health. So share this video with your loved ones. Hit that subscribe button for more health tips,